Perfect. Good afternoon, portfolio friends and members. It's wonderful to have you with us today on this seminar, this hour-long overview on women's heart health and what the new innovations are that are going to enable us to increase our health span and really look at, using the knowledge and new research and information that's out there as we age. Heart disease is the leading cause of death for women. And, some of these powerful signals began decades before, there's any kind of heart health, issues that we're often aware of. But so many things are happening and so many signals happen during our lifetime. And we have the experts in the field with us today. I'm so excited to have them with us. And I'm just going to, acknowledge all of them. They'll introduce themselves with a little more about their backgrounds. But we have with us Manish Jain of Mervi, the CEO of Mervi, one of our favorite company investments. We have Tracy Warren, and Tracy is the lead at the American Heart Association's Go Red for Women's Venture Fund. And Tracy has been a part of Portfolio since the very first month that we started. So welcome, Tracy. Great to have you here. Our own Dr. Faz Bashi, who's a venture partner in all of the women's health funds since the very beginning in 2018. And then a new friend of ours, Dr. Nisha Parikh, who is the cardiologist and system director of the Women's Heart Program at Northwell Cardiovascular Institute. And I know there's a lot more to your title as well, Nisha. So, we'll be looking at that. Before we jump in, let me just say that, as many of you know, but some of you are new to us today, Portfolio created the first venture capital fund focused in women's health in 2018. We're now the most active investor in women's health in the world with 46 company investments just in the women's health space, another 25 beyond in healthcare, beyond women's health, but specifically focused in issues that either impact us directly or differently or disproportionately. So we have many companies that are focused around women's health, and we're really glad to have Manish with us as one of our portfolio companies today. Well, let's start out. Let me just toss it over to each of you, and if you tell us a little bit more about yourselves, how you're working in the space, and then we'll really get deep into the women's heart space as we go. And would you start for us, Faz Bashi?
Hi, everyone. I'm Faz Bashi. I'm in the San Francisco Bay Area. My background's in healthcare. I'm a physician. I'm not practicing. I spent most of my time doing academic medicine work, so I was very interested in all the immunologies and virologies of things. Slowly, my friends pulled me into angel investing. Trish pulled me into Portfolio, which I'm so honored to be a part of. We're making some incredible investments. And it's just a real pleasure to be with my colleagues here to talk about this important subject. So thank you.
Thank you, Faz. Manish, tell us a little bit more about Mervi.
Thank you. Well, first, thanks for the support to all the portfolio LPs to bring on Mervi in the portfolio. We're really excited to be part of portfolio and everything it's been doing over the years in women's health. I am CEO co-founder of Mervi. We started in 2018, and I think the goal was really to bring a more precision level of medicine to pregnancy health, which we see in other advanced areas like oncology. There's been a lot of investment and work in the last 2 decades in early detection and prevention. And I think this is a field where we saw a big unmet need and could really benefit from that. So really excited to be here and to join Tracy and Faz and Dr. Parikh.
Yes, thank you, Manish. And Tracy, tell us a little bit more about your background. You've been doing venture capital investing for, I don't know, 20 years now?
Say it, Trish. Yes, Tracy Warren, been being an early stage healthcare investor for a couple decades now, and have been very fortunate in the last year and a half to join the American Heart Association with a new venture initiative called the Go Red for Women Venture Fund. So we're leveraging the 25 years of the Go Red for Women program around educating patients around their heart health. And we've expanded that with a direct investment fund now focused on early stage companies in the broadly defined definition of women's health as you listed, Trish. So very excited to be here.
And we're looking forward to co-investing with you, Tracy. There's just so much to do in this space. So we're so excited to have you there as one of our co-investing partners. Dr. Parikh, you're a legend in this space. You've done so much work. Tell us more about yourself and your work.
Oh, thank you so much. I'm so honored to be here, and thank you for all that you do for women's health as well. So as you mentioned, I'm the system director of the Women's Heart Program at Northwell Health. Northwell Health is the largest health system in New York, so it encompasses 28 hospitals and over 1,000 clinic sites, from all the way from Eastern Long Island into Hudson Valley in Connecticut now. So Northwell stood up a system director role a couple years ago, and since then we've extended the existing Women's Heart Program across the entire geography of Northwell. This includes 50 plus cardiology physicians that practice in different areas of cardiovascular disease, including cardioobstetrics, heart attacks without obstructive coronaries, and other areas. So it's been wonderful to be able to build these programs in my passion area. Prior to this administrative role, I was a clinician investigator at UCSF with roots in California. I see Faz's Cal sweatshirt, and that gets me excited. I'm a bear.
Well, wonderful, wonderful to have you and all your expertise. And a number of you are dropping your names into the chat, and I want to encourage you to do that. Let us know where you're coming in from. Let us know if you're already a portfolio member or just joining us as a guest. And I want you to feel comfortable as we go through this to drop in your questions. We will address questions too at the end. But as you're going, if something pops up or you want to add a comment or a question, we'll be watching the chat and the Q&A and weaving these in as we go. So this is really for your benefit and for all of ours. And as a woman over 60, this is, an issue that's really near and dear to my heart as well. I know that my health span is going to be dependent on my ability to keep my heart healthy. And Tracy, with that, let's have you, coming from the American Heart Association, kind of give us the lay of the land, both the good and the bad.
Yeah. And again, I think it's a really timely topic, right? We do know that women's cardiovascular disease is the number one killer of women, more so than all cancers combined. And unfortunately, we put out a statement yesterday that gave some pretty sobering statistics that I'd love to share with the audience. We were projecting sort of where women's heart health, so both heart disease and stroke over the next 25 years is going. And the scientific statement from the American Heart Association listed that by 2050, 60% of women in the US will have high blood pressure. We're fewer than half today. 25% of women will have diabetes compared to about 15%. And more than 60% of women will have obesity. Today, that rate is around 44%. So unfortunately, some pretty sobering trends for where our health is going. Probably as important to understand is this, heart disease is often seen not only as a male disease, but a later in life type of condition. Unfortunately, I think for younger women, those being sort of 20 to 40, where the statement predicted that nearly a third of those women will have some form of cardiovascular disease. Today, that's less than a quarter. So I think, same thing for diabetes, growing from 6% to 16%. So I think we do have to really acknowledge that this is not just a serious condition today, but trends are not in our favor. As importantly, these increases are far more prevalent around women and girls who are Black, Hispanic, multiracial. And so I think thinking holistically about access and comprehensive care models is really important. So that's where we are. Happy
Yeah.
to opine later, but I think those kind of set the table for the conversation.
Wow. I mean, I think that it's really time for us to understand the importance of this and take it seriously. And so glad that there are all the people on this call that understand the need to be looking at heart health. Dr. Parikh, you've been looking at heart health over the whole lifespan of women. Talk with us about kind of what those key vulnerable periods are in our lives.
Yeah, absolutely. So, as you mentioned, and as I think Tracy was indicating, atherosclerosis or the early origins of heart disease, they start well before adulthood. We think of them as starting actually in having a fetal origin and then sort of developing and growing over time from adolescence to the teenage years and beyond. The two vulnerable periods in a woman's life that I think could be leveraged better and that we don't are the childbearing years, so preconception, pregnancy, and postpartum, and then menopause being that second time period. But if I could just concentrate on that first for a moment, I think the work that Manisha's company is doing is fantastic. It's really looking at pregnancy as a stress test. So we know that a woman who has a normal pregnancy has less of a likelihood of developing high blood pressure, diabetes, and heart disease and stroke later in life. But if she has a complication like preeclampsia, that really tells us that that's an early window into a higher vascular risk. And then menopause is another time period that we've always known is associated with an increase in lipids, in blood pressure, and other areas. But we're really starting to do a deeper dive into this area now. And that is a time period where a lot of women are coming to doctors wanting treatment for symptoms that range from head to toe, as I think many of us have experienced. And that is a real opportunity to, again, remeasure risk factors and take that opportunity to better understand where we can modify blood pressure, help with cholesterol and lifestyle changes. So I think pregnancy, menopause, two opportunities for us.
Mm-hmm. And does that even begin at the perimenopause space as well? I mean, we're starting to understand now how
Yes.
early perimenopause really hits us.
Absolutely. We know that early menopause, menopause before 45 years of age, is associated with cardiovascular disease. So, for those women who have either a surgical menopause or maybe premature ovarian failure, sort of like that more quote unquote natural menopause, that's something to take into consideration when you're thinking about your own vascular risk. We know that hot flashes, frequent and extended hot flashes, are also related to cardiovascular disease. We don't understand the mechanism. I think this is where technology companies, this is where we really need work to concentrate on to really help us.
Mm-hmm. All right. And, I know there's so much we've always suffered, women have about not having the kind of research into, all conditions that impact us. And, you know, with, with aging and all with menopause, we had some bad information, that had to do with hormone replacement. And many of us, were way more concerned about breast cancer, the potential of breast cancer than understanding the importance of protecting our heart. I mean, I think that during that time period for me, even as someone in the healthcare space, I didn't really understand it. Um,
Yeah, I think that unfortunately, this really speaks to that larger problem of women not having enough studies that can really inform our healthcare decisions. So when the large studies of hormone therapy for primary prevention and secondary prevention didn't show an effective protection on the heart, we stop studying it altogether. And companies stop making therapies for women to deal with menopause symptoms, thinking that, okay, let's just not go to that area and let's just close the door on that. But the truth is, all of us have been going through perimenopause and menopause, regardless of whether we were studied or not. And so we still need information, we need therapies. And there are many unanswered questions with regards to menopause and the heart
Mm-hmm.
and the brain.
Oh, yes, yes. And now we're at least seeing some companies I know, both with our Maven clinic and MIDI and some of the others. And we have a couple of billion-dollar plus companies that are,
Amazing.
finally funded and really looking at how we deal with menopause and actually all, the issues around our health. Let's go a little deeper, Manish, with you. And again, we love being in Murvy. Murvy is in our Rising America Fund, which is the fund focused on people of color, on women of color. And I know it really impacts women of color, preeclampsia. Can you go and it's in our Women's Health Fund 3, I believe, Foz. I'm looking at Foz because I know he's the lead on this company. Can you go a little deeper for us on how you're impacting this core condition of preeclampsia that has such an impact on women?
Yeah, absolutely. Happy to. And again, thanks again for the support, because my takeaway from these really sobering statistics that Tracy talked about is we gotta do something, right? We have to make a change. We need innovation, and so it's really wonderful to have groups like Portfolio supporting that necessary innovation. I'll just dive a little bit into preeclampsia and just follow up on Dr. Parikh's, how she discussed it as a stress test in pregnancy. And in some ways, preeclampsia is failing the stress test, right? And it creates all of these consequences. I think it's worth pointing out that our prenatal paradigm was developed almost a century ago in the 1930s, and it was actually developed to detect signs and symptoms of preeclampsia as early as possible. And it worked well for many decades, and now we need to improve on it. And I think there's been a lot of talk of updating the prenatal care paradigm. So preeclampsia is itself going to affect 1 in 10 pregnancies, and by 2028, it affects both the mom and the baby, right, with lifetime consequences. It's not just high blood pressure. It has systemic effects. We know the risks for cardiovascular disease, stroke, neurologic conditions, retinopathy. If you have severe preeclampsia that requires a preterm delivery of the baby, then it's almost 8-fold higher risk over the lifetime for cardiovascular disease. So these are just massive modulations, right, on health and biology. So it's not just dangerous in the moment, but it has such big consequences. We use a phrase sometimes within Mirvi that pregnancy health is lifetime health, because often I think in terms of awareness, people think of, oh, pregnancy, delivery, we're done. And it's really just the beginning, right? You're not done. It's really the beginning when we think about women's health with so much impact. So what are we doing at Mirvi? I think just borrowing from other areas like oncology and cardiology, where we are more advanced in preventive care, I think we needed to just take a step to do early detection so we can understand who is at risk many, many months before symptoms occur, right? So at the subclinical level, at the asymptomatic level. And then we have an opportunity to do preventive care. Because I think it is definitely, there's definitely an area where we need much better awareness of those who get preeclampsia and how to manage cardiovascular health over time, lifetime. But a better path would be to actually try to prevent it in the first place from occurring. And that's really our focus as a company, and it takes a lot of effort. Life sciences and healthcare is not easy. In our case, we did a large prospective study with 10,000 plus patients across the US, very diverse. It's a multi-year effort, and generated a lot of data. But from there, we were able to develop and validate a predictive signature. And so now the company's at the stage where we are working closely with insurance companies to get the test covered so it can be available to all moms. But hopefully what that allows is the ability to detect disease at the earliest stages when you can prevent it.
Mm-hmm. That's wonderful. Now, Foz, you've had this, Foz is, as I said, a partner in our, we're now in our 4th fund. So Foz, you've led a number of investments since 2018 in the women's health space. And you brought Murvi and Manish to Portfolio. Can you talk a little bit about what really attracted you to the company and to the solution and to what Manish is doing?
Absolutely. Let me start by saying this. A lot of people have asked me, why are you focused on women's health? Women's health has so many solutions. We have them all out there. To which I respond, no, we don't. We don't have the right solutions. Women have been excluded from a lot of things, including understanding the basics of what's happening that is different from women. And the other thing I want to say is what you've said all the time too, Trish. Women are not small men. So yes, we have a brain. Yes, we have a heart, and yes, we may be a little bit gianter, but the reality is there's differences in our physiology, our nervous system, immunology, the endocrine system. One of the key things is, how does estrogen play such an important role? Higher concentrations in women versus men. We all have the receptors. Men and women have receptors for estrogen, but women have a higher concentration. And so that means the organs are responding differently. So now I'm going to go back to what you asked me about Manish. One, I've known Manish for years. He's an incredible human being. He's a family guy. He's brilliant. His partner in the technology side of this is Dr. Steve Quake out of Stanford. If anybody knows Steve Quake, knows that he's a prolific inventor and a brilliant man. And then I learned that he was focusing on women's health. And so tell me more. And the fact is, preeclampsia is unfortunately a silent killer. And Tracy mentioned it earlier, Dr. Parikh mentioned it also. The silence also needs to stop when it comes to the populations that are most at risk as well. A lot of us have access to healthcare, but there are growing populations of women across the country who are in deserts, and they don't get the proper workup. So here's Manish. He's developed a diagnostic that gives you an answer about whether you have a predilection for preeclampsia, which means you can also plan, which means your providers can also create plans, which means if you're in a desert someplace where you don't have the right care, you can plan to be closer to the care that you need. So there are a number of things that really attracted me to Manish, and the fact that we're actually in this amazing deal where we have a lot of amazing other investors in the opportunity just makes it a no-brainer.
Mm-hmm. And boy, there are more and more healthcare deserts for women, especially where it comes to childbirth, right? And we're also, as I said earlier, in our Rising America Fund, which is focused on people of color, they've also invested in, that fund is also invested, as well as our Women's Health Fund, because this is a killer for women of color, right? Manish, I mean, even, some of these Olympian women from a number of years back that had, were impacted by preeclampsia, and myself when I had twins, and I didn't know until right before, they were wheeling me in for an emergency C-section. And, it's so important to know in advance.
Yeah, one of our advisors is Alison Felix, and there's a photo from the Olympics in 2016. Her and three of her teammates, four of them, they're there, won the Olympic gold medal. And a few years later, 3 out of the 4 have been affected by preeclampsia, nearly died. One of them actually passed away. So it's kind of unbelievable, the impact, right? This is a indiscriminate disease, and it's really something that is just staggering in terms of impact.
So, Dr. Parikh, what do we do? What can we be doing now? What do we do to prevent heart disease? Should we be thinking about? I mean, I think you mentioned earlier that this starts even younger in childhood, and so what should we be thinking about? What is critical for us to be protecting ourselves now and our families?
Yeah, I mean, I think about the statistics that Tracy presented, which are just really hot off the press from yesterday. And it's sobering. It's what we know that there's these early underpinnings of heart disease, but I think what we haven't done is translate that knowledge into dissemination. So I think making parents aware that, hey, your kid's lifestyle is important to think about early. Exercise and diet aren't just things that we institute later in life. So that is important. Knowing your child's blood pressure and if it's kind of creeping up, or if you're a woman, knowing your blood pressure going into the pregnancy is really important. The number one predictor of hypertension is your blood pressure. So if your blood pressure is creeping up, there are ways to lower it. There is exercise, there's heart healthy eating, salt reduction, alcohol reduction. There are lifestyle measures to prevent the onset of hypertension. So that is very powerful. And I think knowing the rest of your numbers is powerful as well. There's Life's Essential Eights put out by the American Heart Association, which creates a nice rubric for the types of lifestyle factors that you should know about. Sleep duration, for instance, lack of smoking and tobacco use, cholesterol, and other things. So I just urge you to check that out.
Get a dog.
Oh
Get a
my
dog.
goodness. Yes, thank you, Paz. You're so right. There is data. There are actual studies that pet ownership lowers blood pressure. And then I think we were discussing earlier that increases social bonding in families. You're going to say all that part better than me, Faz, but I absolutely, would urge you to just love on your dog even more because he or she's probably preventing heart disease as we speak.
So, Dr. Parikh, Susan Chen asks if estrogen depletion in peri and full menopause is a contributor to disease, why aren't we recommending all women take on HRT as a preventive versus symptom-based? She says
Sure,
most
that's a
doctors are
great
still cautious.
question.
Yeah.
Yeah, and this was really the basis of what we called the hormone hypothesis. There was decades of studies that suggested that in animals or in sort of more limited studies that estrogen would be protective for heart disease. But in all of the clinical trials that we've performed, it's either been null or it actually in the sort of largest clinical trial of oral equine hormone therapy. There was a signal of, there was increased risk of stroke and vascular risk. So we don't actually recommend it. What we know since that period of time is that if you do take hormone therapy closer to menopause for a limited amount of time, say 5 years, then it doesn't protect against heart disease or stroke, but it can help with symptoms and it is not harmful, at least in that quantity. Other than that, we don't really have any other long-term data with sort of transdermal estrogen or other forms of. So I feel like the jury's out for that particular formulation, but we have shown that taking hormone therapy close to menopause isn't harmful for the heart. It's not protective. It's not going to prevent a heart attack, though. So I want to definitely get that message out.
Mm-hmm. Well, let's just stick with that. There's been some articles saying that GLP-1s are protective of the heart. Is there data out there that says that? Or is that
it is heart protective. I think all of the data we have suggests that it prevents against all the badness in the heart. And so I think that is one of the reasons that we have been enthusiastic about GLP-1s. It's effective for weight loss, and then all of the other outcomes that come along with that seem to get better as well. Diabetes, the kidneys, things of that nature. We've seen some improvements for outcomes in diastolic heart failure, and other areas where it's been hard to actually show benefit with other agents. So.
We've talked, we haven't really been deep into this part, Dr. Parikh, staying with you on this, but can you tell us a little bit more about coronary microvascular disease and how that impacts women and what we should know about
Sure. Well, I'll just lay the background that 50% of men and women that come in for a diagnostic angiogram, so a look at the heart arteries, those coronary arteries that feed blood and oxygen to the heart, 50% of people that we bring in for that don't have blockages in their heart that would cause a hemodynamic problem, either angina, heart-related pain or a heart attack. So what is going on with those 50% of people? Are they all having non-cardiac chest pain? Probably not. What we know now is a significant proportion of people that present with a heart attack or with angina and are brought in for that cath are going to have disease of their microvasculature or some other form of a problem with their heart artery that's not due to like a classic blockage. But let me talk about microvascular disease first. So that's disease of the tributaries of the epicardial coronary arteries. The epicardial arteries are the ones we can see with the naked eye when we look on an angiogram. But coming off of that, just like a stream would come off of a river, these small streams are the microvasculature. And we can't see those with the naked eye, but we have a way to test for them. We can inject a medicine into the heart arteries and then test for the flow before and after that injection. And we have ways to diagnose with high certainty any disease of those small blood vessels. And we also can tailor our treatment if we know that you have the small vessel disease. I mean, the other benefit, I think, for both men and women with this problem, women are much more predisposed to microvascular disease. But one benefit is just knowing the diagnosis, because I have so many patients that cycle through the emergency department or they're constantly seeking medical care and their symptoms are dismissed and they're told that it's all in their head. Many of these women will have a condition that, unless you go to a specialized center, you're not even going to know you have. The other condition that affects men and women that can cause a heart attack or chest pain is called spasm. And that's just what it sounds like. It's spasming of either the large or the small arteries of the heart.
Mm-hmm.
Again, can be diagnosed with a special test called a coronary functional test. And unless your hospital has that, you might not even be referred for this. It's something that's, I think, underdiagnosed in the US. At Northwell, one of the programs we've developed is a coronary functional testing program, and we have it at 7 sites across the system now, really to get these patients a diagnosis. 70% of our patients are women, 30% are men.
Wow. So I know one of the, areas where we'll be talking about is how we do advocate for ourselves in these environments where there's, there's just a lot of breaking information coming in, and we'll go a little deeper on that momentarily. But Foz and Tracy, what are you seeing out there that's on the horizon, that you think can really make some major improvements in women's heart health? What should we be watching for and thinking about kind of in the health innovation space now?
Tracy, you want to go first?
I'm happy to. I think in some of the areas that Dr. Parikh has outlined, we've been looking a lot on the invasive, ideally non-invasive diagnostic front. So are there opportunities for things like non-obstructive to actually have that be more of a screening platform that can be available and more accessible to sites that don't have the capabilities that Northwell and others do. So again, one of the big tenets for us is things that are available to maybe lower resource settings, rural hospitals, et cetera. So non-invasive testing for non-obstructive disease is a big area we're looking. Similarly for AFib, so atrial fibrillation in women is often, we need to open the funnel and find more women who have AFib. And so we've been thinking a lot about how wearables or other real world data might play into that to increase that funnel. And then we are looking largely at some of these windows. So one area we're very focused on is cardiometabolic in midlife, but as opposed to some of the GLP-1 and other approaches, really what should care models look like in that condition? So whether that's educating primary care and involving more of a cardiovascular screen in this midlife period, what access points are available where women are already seeking care, like a mammogram, et cetera, where we could also screen for heart disease, where we already have the woman at an access point. So that's it's all around getting, more women care earlier is our hope. And I would say it's a search, but those are some areas that we're excited about.
Mm-hmm.
And I'm excited that Tracy's on top of this, because the American Heart Association, that the heart part of it says it all. It's right in the center, right? So one of the things that we're all talking about here is we all have a sense of curiosity about why is it that women are dying from heart disease. And if you have that sense of curiosity, then you'll want to find solutions like Tracy just mentioned, wearables. I'm excited about the fact that folks are focusing more on their hormone status, what's going on with the different hormone levels for women, from estrogen to progesterone to other things as well. So being able to understand on a holistic level, where you as an individual are taking control of your life and understanding what this body is actually doing, I think that's a key part of it. I like the clinical part of this, like what Manish is doing, where we have these new diagnostic capabilities using biomarkers that folks never even thought about before, using new language models. By the way, let's think about those language models that are out there right now. There is definitely a bias in those models that are focused more on, creatures like me that have an X and a Y. But XX this is what we're talking about here. By the way, interesting point of fact, did you know that during the first 6 to 7 weeks of embryogenesis, as the embryo is developing, we're all actually women? It's a fun fact. It's true. So the connection here starts from a very early stage, where we can understand what is happening to the physiology of our bodies. Let's go back to the placenta and the fact that during pregnancy, there's this new organ that's developed that looks very much or functions very much like a heart, right? So the microvasculature of the placenta, the microvasculature of the heart, what is happening there when preeclampsia hits? We should be asking a lot of the questions, like what is happening there to the microvasculature that's causing a spike in blood pressure? So many things and so many opportunities for amazing minds that we have here who are also attending this call. And I think there's so much opportunities ahead of us.
Would like to say though, Trish, sorry to follow up, but I think this is really important when you have a forum like this. There is a lot of non-evidence-based approaches to managing this that we need to be very cautious about, right? I think to Dr. Parik's point, hormone therapy, selective, the data is not always super strong. It's not all physicians are educated in appropriate use. A lot of this stuff should be done with a well, established clinician at the bedside who's thinking about the evidence-based versions of this, so that we're very careful not to exacerbate women's risk in different areas. So I do think we have a lot of opportunity on the innovation and investing side to create new solutions. I just encourage everyone to think about make sure those are evidence-based, guideline-directed care that either we're developing through new technology or validating or treating. But I worry a lot that this field, women's health in general, is a lot of fear and anxiety and people trying to capitalize on that for people and for women. And it candidly makes us very nervous. Some of the recommendations that are out there on microdosing and things where we don't have data, that I think we need to just be very vigilant about to do a good service for patients. So that's just my cautionary tale is, stick to evidence and lifestyle change, unfortunately, is probably the easiest lever that everyone has access to if they want to improve their heart health.
And just a quick question to Manish, and we'll talk more about care. But Manish, you've been using, I know you use artificial intelligence on top of your data sets. And again, we've been so under-researched. It's not been that long since women have been included in healthcare studies, at all. And do you believe that that artificial intelligence can assist us in using the data we have, or pulling out, more actionable knowledge from the research that's out there?
Yeah, great question. There's so many ways I think, people think AI can solve everything, but let me just take one area where we found it's been quite helpful for us, which is really in understanding the biology of the disease, right? So I think as Dr. Parikh mentioned, we have a couple of ways typically at looking at the biology, what's happening, right? Beyond symptoms is one is imaging, and that works pretty well, but it can get pretty sophisticated at times, and then access can be quite limited with imaging. That's a challenge, right? And as we have more care deserts and uh, challenges with access, that may be a limitation. So if you have a blood-based approach to try to get to the same information as possible in some cases, that's really powerful because it's much more accessible. So what we did in our study was really look at the entire coding genome, so the genome that codes for proteins, gene expression. It's about 2% of the genome, and we've done that for about 15,000 pregnancies. So if you look at all of that, it's about almost 1 trillion molecular data points, right? And this is a study which, of course, it was all women, but more than that, we wanted to make sure it was very representative of the US population. So I think both underserved communities, rural communities, not just academic medical centers, but community settings where patients go frequently. So with all of that, it's a lot of data. And so I think finding the signatures is you can do it traditionally, but it takes long and you might miss things. But really, machine learning and AI tools were very helpful. That's how we developed the signature for preterm preeclampsia. And then, of course, the key is, you can't have fuzziness with AI and get a wrong answer. So the way you do that is take the signature, lock it down, and validate in an independent, unseen cohort. And you got to do that piece to make sure that it's robust. So I think it's a very powerful tool, but you also have to make sure you have good validation. So we did that. But that said, it's very powerful because ultimately biology is pretty complex. I think Faz talked about the placenta. It's an incredible organ. Like it's this life cycle of 9 months and does everything to create life. So it'll take a lot of data to really start to tap into and understand the biology, and these tools will be quite powerful to do that.
Thank you, Manish. And I just want to point out, if anybody hasn't been following the chat, the participants in this call, in this panel, are like a who's who in the heart space as well. So we have a number of amazing organizations that are working in the space, and physicians, cardiologists, and professionals. And I don't want to start naming them because there's so many, but you'll see those just running through here, as well as other innovative companies. But just one right off, the Preeclampsia Foundation is in the house with us today. Dr. George Sands is with us, also from New York. And Matriarch, another great group, and others. So just just so much, amazing expertise around this call, both from the people that are participating and dropping in questions. And I'm moving to these questions now, and they're interacting with what we were looking at, Nisha and Tracy as well. A number of people asking about how do we, let me get back up here. What do you recommend, Dr. Parikh, that most patients, especially women, do to get coronary functional testing done for preventive measures for conditions such as preeclampsia, HELP, etc.? What do we do if we're not there where you have specialists?
Yeah, these tests, the imaging tests are probably less available than the invasive test. The invasive test is an angiogram, so it's threading wires and catheters up to the heart and then doing injections. And, unfortunately, swallowing the risk of of major vascular complications and death with that procedure. Very small chance, but it's there. So we don't recommend it if you don't have symptoms of heart attack or chest pain. It's really for those subset of patients. So we wouldn't do it to screen for your risk of preeclampsia. But as Tracy mentioned, if there are technologies coming down the pike that are non-invasive, that are able to test for microvascular dysfunction, and they relate to the risk of preeclampsia, they could be used in conjunction with molecular markers or perhaps on their own. And this is, again, these are more ideas than anything at this point. So I think that this area is ripe for innovation. I too have been long fascinated with the placenta and knowing more about it. And I'll just kind of throw out one thing that got me really interested in that connection between pregnancy complications and vascular risk. And that was that when you look at a placenta that's affected by severe preeclampsia, you will often see a thrombosis in the arteries of that placenta. And it looks very much like a through and through heart attack, a large heart attack, if you looked at the pathology of the heart that suffered from a heart attack. Similarly, if you look at the arteries in a slice, microscopic slice of somebody that suffered from preeclampsia, if you look at their placental arteries, you can sometimes see medial artery hypertrophy, much like we see in essential hypertension. So it has this analogy to heart and vascular disease that really makes all of us see that connection. But we do need to understand more about it, why it happens, how it's set off, and how to prevent it.
For the non-medical hypertrophies, just increased size of the musculature around the vessel. So that's super important. Thank you for saying that.
Mm-hmm. Another question coming in from Julie. Do you have a structured plan? And I think this is also for you, Dr. Parikh, and probably Tracy as well, but just a structured plan to improve physician education in women's health with the goal of enabling better diagnosis and a more prevention-focused care model.
Yeah, I mean, we have our plan in our health system, but I think we need a better plan as kind of a national community, international community. Absolutely. I think one thing that's driven excitement in women's cardiovascular disease is that we have more female cardiologists. And I don't mean to stereotype, but our field was largely men for many years. When I interviewed for cardiology, it was probably close to 12% women, and it's maybe a little bit more like 15% now. But in our training classes, we have 20% female fellows. And I mean, I think that if everyone was like Foz, with that excitement as a man for women's health, or like Manish, then, our field would be different and we'd have a lot of these questions answered. But now that we have this sort of groundswell of interest in kind of, women's cardiovascular disease because of the composition of the workforce and maybe the public asking to know the answers to these questions, I think we should really take that momentum forward. I don't know if that really answered the question. There are our health system as well as others have developed fellowship training programs in women's heart disease. So I think that that's one small step forward, and that's happening around the country.
Mm-hmm. Let's see. We have
Can I piggyback on that really quick? Because I appreciate the shout out to me and Manish, but there are so many others out there who are also equally aligned around women's health. My BFF Sherry Mack is here, and so is NBA superstar Kenny Thomas, who lives in New Mexico now.
Wonderful.
We have so many ways of getting the voice through Tracy, through Dr. Parikh, through Portfolio, to be able to say, hey, this is something we need to work on.
Mm-hmm. Absolutely. And welcome, Sherry. Dr. Sands is talking about how we need much more clinical evidence in this. And, let me say, I always encourage our members on here as women to aggressively look at being a part of the research that's out there. I myself, I'm a member of the UCSF Cardiology Research Plan, a 10-year research study looking at AFib and wanting to make sure women are represented. Mark Cuban has put in millions of dollars to back this. And every quarter, I wear a heart monitor for 5 days. And every week, I take, a 6-lead EKG on my phone. And our work and our, volunteering to be in these kinds of studies can really make a difference. So, and there's a number of apps out there that let you know where they're at. But we really want to encourage you both to take care of yourselves, but if we can also add knowledge and research by participating, that's really important as well.
If I could jump on that too, the Go Red for Women has what's called Research Goes Red. So if you sign up, you can contribute in that way as well. And that's a national effort. So also encourage folks to sign up there to start to become active in their health and for others.
Boy, American Heart Association has done so much in for women on this, and we're just so thankful for their work. Lots of shout outs over here. I've also had a number of questions, so I'm going to ask Slayton and Molly. Be sure and drop in the links for our women's women's health fund for which is currently open to new investors, and you can even invest with your IRA. An average investment's about 30,000, but you can come in for 10,000, and that money is spread across 12 to 15 companies. And friends, your money is what has enabled many of these companies to have the fuel to grow. Oftentimes the technology or the innovation is out there, but there's not enough people investing in women. So our money together, even small amounts, are making huge differences. Also, Slayton, if you'll drop in the link for Rising America, that's the fund focused on companies that over-index for women of color. And we're in MRV, and we're also in Your Choice, the first male birth control pill, and Backpack Health, which is mental health for children. So check those out. And I think you'll also drop in a link that if you want to talk to our investor relations people, they'll answer any of your questions. They're on here today as well. And it's so important for us to take care of ourselves and use our investment to create this. A question has come in saying, what books, this awareness is so important. Are there books or podcasts or other things? What's out there that I can continue to educate myself on what's happening and enable me to be an advocate for myself in this discussion? Anything out there from you, Dr. Parikh, Tracy, Manish, Faz?
I have one. So Byron Katie, Loving What Is. Read it. Buy it. Don't read it. Put it on the bookshelf. But just remember, we had this conversation. It is all about health. It's all about how you relate to this incredibly stressful, anxiety-filled world. So yeah, that's one. It's not clinical.
Loving What Is.
Loving What Is.
Yeah.
Okay, I'm typing it in for you. There you go. And what else?
There are maybe smaller, so not books, but different life stage associated articles and sort of layperson, so non-clinical on the Go Red for Women website for AHA. So there are different things around actions you can take, questions you can ask at appointments, things like that. So I think it's a good resource for women to check out. To help arm themselves to be advocates at their appointments, whether it's with primary care or other folks.
Wonderful. That's perfect. Does anyone else have any other suggestions? And again, we're trying to find that evidence-based, and in this world with social media, it's so hard to know who you can trust. So
I just wanted to put a plug in for my colleague, Tara Narula's new book called The Healing Power of Resilience. And that just came out a few weeks ago, and it's already on the New York Times bestseller. And she is our associate director of Women's Heart in our Western region, so the Lenox Hill doctor, as well as a news correspondent. But a fabulous book and a really important topic.
Wonderful. Thank you so much. And as you, in the chat, there is just link after link to research papers and materials and studies. And so what I'd like to do, Slayton, is for us to actually, capture all of this, and we will send a follow-up email to all of you because I know many of you are trying to click in and download things. So we'll send a follow-up email that links to all the information that our panelists and our members have shared here. That's really important. We have time for, probably one more question out there.
Before you do that, can I just give you a quick shout out? Because I wouldn't be here if it weren't for Trish Costello creating Portfolio and the multiple funds that we have and the women's health funds, 1, 2, 3, 4, all the way across. So I just want to give a quick shout out to Trish and her leadership. She could have been done anything. She could have been resting on a beach someplace and drinking Mai Tais and margaritas and whatever. But here we are focused on women's health and multiple others that we've created in these different funds. And we truly couldn't do any of this without you, Trish. Thank you. And by the way, if you don't believe me, and if you don't believe anyone else here on this call, you can ask ChatGPT to give a business case. Ask ChatGPT, give a business case for why I should invest in women's health. And I guarantee you it'll come back with this: $1 into women's health gets $3 back out into the economy. By 2040, if we all do this, there will be $1 trillion added into the economy. So there you go.
Thank you, Foz. Thank you so much, and for everything that you do. There again so much important information in here, and people saying, when I go to all my medical professionals, whether it's the dentist or the dermatologist or whatever, I'm asking them, how does menopause impact my life, and what do I do, more broadly to make sure that I can live this longest, happiest health span. And that's what this is all about. And it's enabling us to invest in these companies that are almost a legacy for us and that are meaningful and that provide returns, and they're going to impact our lives. So I'm going to ask our panelists now, if there's been so much covered and some of it's very deep. And Dr. Parikh, thank you for making a very complicated topic understandable to us. It's been wonderful to have you as our newest friend here on this call. But I'm going to ask each of you, just as a kind of parting words, if you can, looking at it from both sides, what would you, as experts in the field, what would you tell your daughter to ensure that she lives a heart healthy life? And what would you tell your mother? So the woman on the other end of that spectrum, to enable her to live as a long and healthy life as we go. And let's start with you, Tracy.
Yeah, that's pretty, as you know, I have 2 young daughters. One of it is know your numbers. I think the conversation early on to know your numbers, track your numbers. Kids love data, right? They're tracking everything. So I think it's an easy message for our daughters and our children to know where you are and how you're trending. And for my mom, it's to stay active, like keep walking, keep getting out there, get a pet. But any of those things to just stay, heart healthy. Part of it is just activity and staying involved. So those are my 2.
Love it. Foz, how about you?
I've said so much already, and I have so much more to say, but be curious. Nothing is impossible. In fact, impossible says, I am possible. Things are possible. Ask people for more amazing people like Manish, who are working on some incredible opportunities for women's health. Just be curious.
Yes, thank you, Foz. And Manish, thank you for what you're doing. What's your final words for us?
Thank you. I have 2 daughters as well who are maturing into young adults, one in college, one in high school. And I think it's really just make sure you're up to speed on the information. We are hopefully going to be in a world where we'll have preventive care. Hopefully, if they decide to start families, they'll have a much different experience than so many do today. But I think the future of preventive care is bright and necessary. And I think just to stay on top of what's happening.
Mm-hmm. Thank you, Manish. And Dr. Parikh, if you'd finish us up.
Sure. So I would tell Layla and Kinnary, who are 20 and 17. Layla's an econ major in college. So I tell her that taking care of your heart early is going to pay later dividends. So the earlier that you take care of yourself, the more power that's going to have later on. And then for mom, who is actually she kind of puts me to shame with her, with the way that she's motivated to stay active. But I would tell her, listen, Mom, taking care of us, and you've been the heart of our family. So we want you to take care of your heart so you can continue that. That's what I would tell her.
Thank you. Thank you for sharing your time with us today. Thank you for this wonderful panel. I know it's just full of thank yous and accolades in the chat. Thank you for being with us. And we're just starting, friends. And we're all in this together. Thank you for all of our participants and our team. And we'll be following up so that you can benefit from everything we've talked about today. Thank you. Bye.